again. This is the second in a series of discussions about making healthcare decisions put on by AARP Maryland in partnership with the State Advisory Council on Quality Care at the End of Life and the Horizon Foundation. My name is Ted Meyerson, and I'm an AARP Maryland volunteer. I'm honored to be the moderator for this discussion. We know millions of people have been infected with COVID-19, and tens of thousands of Americans have died from it. Sadly, the horizon is still with us. It seems certain there will be more infections and more deaths. There's no way of predicting who's going to get infected and who's going to die. It might be you or me or anyone. We should all do everything we can to protect ourselves, but we should also be prepared if the worst should happen. Every eligible person can plan to maintain their right to control their health care, even if they were to become so sick they couldn't communicate their wishes. In our last discussion, we spoke about advance directives being the best way to do that. Even though family and friends benefit by knowing what medical treatments you would want and what medical treatments you would not want, you are the real beneficiary, because advanced planning is the best way for you to keep control, to keep your humanity, and to avoid being overwhelmed by medical technology. We're fortunate to have the same extraordinary panelists that participated in our first discussion. Dan Morheim is a practicing emergency medical physician, was a member of the Maryland House of Delegates from 1995 to 2019, is an author whose newest book, Preparing for a Better End, will be released this fall. Amy Tucci is the president and CEO of the Hospice Foundation of America, which recently completed 2 national outreach projects involving advanced care planning. One involved Being Mortal, a PBS frontline documentary, and the other was the Hello Project, which used the conversation game Hello to engage underserved populations in conversations around end-of-life care. Dan Reason is the executive director of the Maryland State Medical Society, MedChi. MedChi is the statewide professional association for licensed medical practitioners, whose mission is to serve as Maryland's foremost advocate and resource for physicians, their patients, and public health. So now, let's go a little deeper into what advanced directives are and how you create them to make your advanced care plan. You know, this weekend, I had a conversation with a friend and we were talking, and he said, well, what's the difference between a living will and an advanced directive? And I think that's a valuable question to answer even before we get started. Gene, would you take a swing at that?
Sure. So essentially, and Ted, thanks for having me on today. Essentially, most folks use those 2 terms interchangeably. So like a layman might call or say living will and they actually mean advanced directive, or might say advanced directive and mean living will. Essentially, advanced directives include 2 things, which is the living will, which in layman terms essentially is the document that says what you want to have happen with regards to your care. And it also includes the healthcare power of attorney, which is the document where you've designated someone specifically to have the power to make decisions for you if you're incapacitated. And the advance directive is the 2 of those, where the living will can just be that one document. But again, I think a lot of people use the term interchangeably, and we're kind of fighting over terms.
Thanks. That's a clarifying statement that I'm glad to have out there. How do you make an advance directive, Dan? I know that you were involved with creating them, so tell me how it happens.
Well, advance directives are 3 legal forms that are available from many sources, including hospitals, in Maryland, State Attorney General's website, but it's throughout the United States through health departments and their State Attorney General's website. My personal favorite is an online one called mydirectives.com. I find it very useful and thorough. There's one called CAPE. And also you can use the form as you see fit. You can add things into the form. You're not bound by the form. So if you want to specify certain aspects of your care, for example, mine says, take me outside as much as possible, that kind of thing. You can do that. You can specify and should specify that you want early palliative care and early hospice care contacted as soon as possible. And you can also specify the details about body disposition, what happens with your remains after you die. So while this may sound a little grim, it's actually all about empowerment and respect for your personal values. Many sources online in all the usual ways.
Well, tell me this, do you have to have your family involved in order to do this?
You can involve anybody that you want to talk to. In the study that we did when I was on the faculty at Johns Hopkins School of Public Health, we found that overwhelmingly people wanted to talk to their physician or their primary care provider. And so I think physicians and those in that world have a huge role to play. But you can talk to anybody you want or nobody. But most people will, of course, talk to their family member, perhaps their spiritual advisors. That's another source, by the way, of advance directives. For certain religions have their own versions that are consistent with their belief systems. But you can research this online. However, whoever you want to consider as a valuable resource for you, you should contact. And then in the end, the decision is yours. The final bottom line to this is only you can complete your advance directive. Nobody can do it for you. So the final version is what reflects your personal values.
Gene, I hear what Dan said, but who's really creating the conditions? Is it the family or the individual?
It's really the individual. It's your personal decision to do this. And in fact, not only can the family not override it once you've properly done an advance directive, the physician can't override it. Now, the physician can't be required to do things that aren't medically necessary or aren't going to work, but a physician cannot do something different from what you've decided in that plan as long as it's medically reasonable. So really the power is with you once you've done this, not with your family, not with anyone else. And I think that's huge. And that's the value in doing this. It's a way of making sure that you actually get what you want, that your choices are honored. And I think that's key.
Let me add too.
Go ahead.
Yeah, that also takes the burden of decision-making upon family members. There are a lot of family conflicts. And as a clinician in an emergency department for over 40 years, and I'm sure other people have seen these kinds of things, families can break up and have fights over these things. You know, what are we going to do with grandfather care and the differing opinions, siblings with differing opinions? This is not really just about you. It's about taking care of the people you say you love by completing the paperwork that's free and legal, readily available, legal in every state. That's what's really important here too.
Sure.
Well,
Let me just jump in and say one of the issues that we see families fighting about so much is artificial nutrition and hydration. And in if you have an advance directive and you specify whether you want artificial nutrition and hydration, it will cut through that family dispute and put an end to it, because withdrawing artificial nutrition and hydration, tube feeding, or another form of delivery is a very emotional subject for people, and families tend to be very divided on it.
well, you know, I'm not going to worry. I've got 4 daughters, and they know what I want. Isn't that sufficient?
Well, it's possibly sufficient, but the best thing is to have this in the document. And there are other documents as well, where thing called MOLS, medical orders for life-sustaining treatment, or POLS, physician orders for life-sustaining treatment, depending on which state you're in and how those laws are constructed. But the more that's committed to paper, the more it's clear. Your daughters may not be able to convey it clearly. There may be differences of opinion in their interpretation. That's why we have documents. We have documents so that there's clarity, as much clarity as possible. It's impossible to be perfect in these forms or have and anticipate every situation and every circumstance. But we want to commit it to paper for the same reason that we commit other things to paper. We're not relying on memory or interpretation.
Well, let me ask you this question. Even without an advance directive, wouldn't one of my 4 daughters be able to make a decision? How about that, Gene? Would that happen?
If you don't have an advance directive, then the decision would the physician in the case will most certainly take into consideration the feelings of the family. But no, it doesn't necessarily mean that what you want to have done is going to be done. And back to your example where my 4 daughters know what I want to have happen. Well, what happens if one of them doesn't agree or changes their mind and then there's a dispute? Why would you put it on them to deal with that? Really, the best thing to do is to fill the forms out and have it in place and have it with your primary care doctor. Have it uploaded through Chris by using the My Advance Directives online and having it there. So the decision that is made is your decision, and it's not up to the whims of chance or other things that could occur whenever it becomes necessary that they need to be used.
So Gene, if I understand what you're saying, if I make an advance directive and select one of my 4 daughters to be my healthcare agent, she then would be able to make decisions for me if I can't, and the others would just have to sit back and watch.
Yes, that would be the case.
If that's how you filled it out, but you can do anything you want. You could say, I'd like 3 of them to have all 4 of them empowered, but 3 have to agree to whatever decision is made. You can construct this as you see fit, and you can change it. So the latest advanced directive is the ones that's operable. So if the relationship change between the daughter in any family situation, as they do over the long haul of family life that we all have, then you can adjust it. So I have 3 daughters, and my wife goes first. But of the 3 daughters, the 2, can make a decision, but it doesn't. I didn't want to specify one because I thought they're all smart and they can achieve a consensus.
The phone would have to ring while we're talking. But let me ask you this question. Suppose I can't find anything that I want to use, and I want to sit down and on the back of an envelope and write something out. Would that be legal?
Yes, it would be legal if you completed all the key elements and you had it properly dated and witnessed. Yes, you can. It's easier to follow a form because most people are not going to have all the information they need about what an advance directive is. I mean, look how much time we're spending talking about it now. But if you want to write it out on a piece of paper on the back of an envelope and it has all the elements and it's properly documented and shared appropriately, then that's the document. But most people are, of course, going to follow a form. And the forms obviously direct you to make sure that the document is properly done.
And again, I just wanted to reiterate that in Maryland, the Attorney General has a really good document that outlines the form, answers questions, and is something that people can easily use to understand exactly what they're filling out. I would just urge people to use the form, but if not the Maryland Attorney General form, one of the other standard forms, because I think it really increases the probability that it be done correctly. If you do some other format or you write something out, you could miss one of the required elements and create problems where it's not enforceable or not usable. So it just seems to make a lot of sense to use one of the standard forms, and then you don't have to worry about it.
Well, what are the elements that would make it legal?
Well, what would be the 3 decisions which are in an advance directive. Number 1 is what kind of care do you want when you can't make decisions for yourself? The second is who do I designate? The third is have to do with a body disposition and organ donation. You have to have it in depends from state to state, but in Maryland, it's 2 witnesses. There's some qualifications about the witnesses, and then you sign and date it. Some states that require notary, so if you happen to live between 2 states, you might want to look at that. The electronic version that the state of Maryland has contracted with is mydirectives.com. It's an easy online system. You can just go through that and it walks you through the entire process. So, you don't have to make this more complicated than it is. The complicated part, if there is, not the form. It's thinking through the issues that are involved. And it makes you reflect about what's really valuable and important in your life and who is valuable and important in your life and who you trust. And that's a good thing to think about. This is all in the end really about empowerment and values, respect for your personal values. It's not a bad thing. It's a good thing that we're fortunate in this time in our lives inside. We have these tools. These have not been available to people for, all generations of human history until the last 20 or 30 years. So this ability to have some say about what happens at the end of our life is a powerful concept and worth reflecting on in itself.
And just to follow up on your question, one other issue is the person who you pick needs to be 18 years old, and it cannot be someone who is an owner, operator, or employee of a healthcare facility where the patient's receiving care. So that's another factor where you can get yourself in trouble. You need to pick, for example, both of my children are under 18. Theo's 15 and Claire's 12. So I couldn't pick one of them to be my healthcare agent. And if I was getting treatment at Dr. Moorheim's health facility, then I couldn't pick him. But since I haven't been getting treatment there, then obviously if I wanted, I could pick Dr. Moorheim and it wouldn't be a problem. So those are other legal factors where you could make a mistake if you're not using forms because you just might not know.
Right.
So
Jane,
I could use, go ahead, Amy.
I was just going to jump in and say that you also can't have someone sign your form who stands to benefit financially in the case of your death. So if you are going to inherit a large amount of money, you're not going, or any money, you shouldn't be signing the form.
As a witness, but you could certainly
Correct.
be designated as the healthcare agent, because typically
Yeah.
people choose their spouse, who is the person who's going to inherit. This is about witnessing the form. Amy's correct on that.
Mhm.
Amy, do you see people bring in advance directives where there are errors in it?
No, not really. When hospice is concerned, the advance directive is maybe not. I don't want to say it's not valuable, but really, before you enter hospice care is when the advance directive is valuable, because that's when you're making those critical decisions about end of life care, when you're preparing your advance directive, and once you've elected hospice. It's clear what you want and what you will receive because it's the type of care you've decided to receive. So you're electing that.
You said, Dan, that there were various parts of an advance directive. Do I have to fill them all out, or can I select whatever I want and get 2 witnesses to sign it? Would that still be legal?
You should fill it all out and select what you want within that. Let me just say that I clearly appreciate Amy's point that when you get to hospice, you've done it. I'm on the other end of the healthcare spectrum. I'm in the emergency room, which is really the portal of entry for many people into the system. And that's where, and in there and in the intensive care unit in the hospitalized patient, that's where an advance directive really becomes important. I can just tell you so many times where I want to do what I think the patient wants, but the patient's unable to communicate. If you can communicate, then we have that discussion. But if they can't, then advance directive is a great tool. The problem is we don't see them often enough. In fact, studies show that only about 40% of Americans have completed advance directive, and it's about half that in the minority population, 20-25%. That ought to be normative. And it's a fair question of can that be done? Anybody who's interested in that, I would urge them to look up La Crosse, Wisconsin, where that town, that city, that region made a decision that they were going to have this conversation. They employed the faith-based community, the legal community, the medical community, and a lot of interested citizens. They have about a 98% rate of completion of advance directive there. And not only are they more satisfied, that's the right word with end of life care, but they reduce their end of life healthcare costs by about 40%, because that's the right way, one right way to reduce healthcare costs. To respect people's values, it's more of a family, spiritual, valuable, transitional experience, and you save a lot of money. So it can be done if we all motivate ourselves, and we're obviously trying to do that here, the four of us, and Rising Foundation and MedChi and the Hospice Foundation and AARP, we're trying to do that. So our message is really a positive message on many levels, and I'm really grateful we get to keep trying to put this out.
Well, if I were to have an automobile accident and you take me to a hospital, how would you know I had an advance directive?
Well,
I don't know who wants to answer that. In the emergency room.
Yeah. So Ted, we're on a curve. We're at the beginning of a curve where we only have 40% of people completing them. We're just getting rolling on electronic directives. MyDirectives.com has a QR code that you can print out that I have in my wallet in the glove compartment of my car. Nothing's going to solve every situation in every circumstance. Let's just be realistic about it. But if you come to an emergency room and we have your wallet, we have protocols to go through wallets and purses so that everything is done right. And if I find your QR code and scan it, then I can get all the information I need about your advance directive. This is not something you put in a safety deposit box. Can there be circumstances where, it's not, you done everything right and it's not available? Sure, that can happen. You could be driving to Ohio and be in a car accident. You didn't have it on you at that time. But we have to look at this as we're moving by degrees, by steps. And step one is people complete the forms. Step two is they're made available. Step three is clinicians will honor them. But it all starts with people completing the forms. And all these nuances we're parsing are just part of that process.
Right.
I want to make one point on what Dan said too. The nice thing about doing it online is, and I mentioned CRISP earlier. CRISP is the Health Information Exchange for Maryland. It allows doctors to access it and see information. The online form in Maryland, the My Directive form, is uploaded into CRISP. So if you go that route, then the emergency room has the ability to go into the Health Information Exchange and pull the data down, and it increases the probability that they're going to have it and have access to it.
Yeah, and hopefully one day we'll have a national CRISP, that anyone can access. And I've just CRISP is great, and you can also it also applies to District of Columbia. So both Maryland and DC are partners in that.
Well, I wasn't going to get into a discussion about linking up to CRISP, but if I have an advance directive with an electronic organization, isn't that in the cloud and available anywhere in the world? Gene, what do you think?
Well, I mean, I guess the key is you need to get it into the hands of the healthcare practitioner who's going to be treating you when you're sick. So the question is, how do you best do that? And there are a couple things that make a lot of sense. One is clearly going through a system that links into an HIE. Again, I think as Amy pointed out correctly, we don't have that nationally. It's not everywhere, but where it is available, that's one way. The other very practical thing that you can do is you can ask your primary care physician to upload it into their EMR, and they're very willing to do it. And then that way it's attached to your record. And I think Dan outlined some other things you can do, like downloading the QR code and putting in your wallet. I think those are all things you can do to give electronic access to it.
On your cell phone.
Right. Yeah. And a little less high tech, the American Hospital Association has a card, a PDF of a card you can print out that says, I have an advance directive, and this is where it is, and these are my people you should contact if you find this in my wallet. So, and that's just a very simple, low tech way to go about things as well.
Well,
let me just say, Ted, I actually take a little one step further. One of the things that I've been advising a lot of people is to prepare what I call a medical go bag, which is 5 sheets of paper you print out. I have it right behind me here. If I suddenly have to go to the hospital, I'll grab it on the way, because I've been in the emergency room for a long time. People come in, even with all the high tech stuff, you still have to take time to go dig it out from wherever it is. It's not always available. So what that has is page 1 is my name and contact information for everybody that should be contacted, spouse, family, and so on. Then I have a copy of my most recent EKG. If you get an EKG, we like, clinically speaking, to see the actual tracing. If you get an EKG, ask the staff to just print one out extra and give it to you, take it home. So I've printed out my most recent lab tests, which if you're with any of the big companies that do that, you have access, any recent imaging tests, and a list of my current medications, which is a really big issue. We don't have access, ironically, to the medications that people take. We do have access to the narcotics they might be taking through the prescription drug monitoring program, but that's only 0.5% of all medicines. All the others we don't have in the emergency room, and we ought to be able to have that. So you can just print that out yourself, just grab it. It's low tech, but you just hand it to the ER staff or have somebody hand it to them, and they'll immediately have all this information and not have to do what I've had to do for my entire clinical career, go scurrying off after seeing the patient or trying to get someone else to spend a lot of time trying to dig out this information. That will facilitate care, expedite care, and give much better quality care. And so I recommend that for everybody.
This seems to be so complicated. Do I need a lawyer?
No, you don't need a lawyer for any of what I just described, and you don't need a lawyer for an advance directive.
Well,
one other
said,
But you can have a lawyer.
You can have one.
Yeah, you can have one if you need, if you really feel like you need one.
I also want, there's one thing that I think is also deterring some people. I think some folks are mixing up, because of the term living will, they're mixing up financial power of attorney. The Advance Directive has nothing to do with money whatsoever. And I think there are people out there who don't get an Advance Directive because they think they have to deal with who has financial power of attorney. And you should there certainly are circumstances where having a financial power of attorney makes a lot of sense, but you don't have to deal with that to deal with this. And you should really deal with this. They're independent. They're separate documents. They're not required to be together. They're not tied together in any way.
And just to pick up on what Gene said, if you're the healthcare agent, you're not responsible for the medical bills.
Mm-hmm.
I think the big question that Gene is bringing up, and Amy has touched on too, is what is holding Americans back from completing these forms? We're a culture that celebrates individual autonomy, personal rights, and respect for our values, and yet we collectively have not done this simple task. We pay our taxes, we renew our driver's license, and we do these other routine things. This ought to be as routine as that. La Crosse, Wisconsin demonstrated that it can be. And so I think there's issues in the minority community of distrust of the healthcare system. There's people that maybe magical thinking, if I fill out this form without dying, that will somehow accelerate the rate to my death. I mean, there are all kinds of reasons. There's people just not aware of advance directives, there's confusion about the form. And our job is to help people overcome that and have these kinds of discussions, which is why I think it's so great that we're doing this. But it really ought to be something that's routine and not fraught with anxiety and tension. It's actually a tension reliever. Yeah. People I've talked to, once they complete their advance directive, think, yeah, why was I fussing about it? This really made things so much easier for me.
Amy, is that what you see, or do you see anything different?
Yeah, I totally agree with Dan. It's just the weight of the world is lifted off your shoulders once it's completed, and you feel like, you can go about your life and don't have to worry about things that you might have been anxious about or worried about if you were to become seriously ill or in an accident. So it's all positive.
Well, I know there's a lot more to talk about, but we're running out of time. If we stop now, would each of you be willing to come back for a third session?
Certainly.
It'd be great.
Well, that's great. So I'm going to thank you again, invite the audience to tune in to the next session, wish you all well, and for now say goodbye.
Bye.